Hello, welcome everyone to the How to Successfully Include Public Involvement in Your NIHR Award Application. I'm the Linda Prince, the Patients and Public Involvement Manager at NIHR, and I'll now pass you on to my colleague, Steve.
Good afternoon, everybody. My name is Stephen Blackburn. I'm Patient and Public Involvement Lead, working with the NIHR Research Design Service.
Thank you. I'll pass you on to you, Merat.
I'm Merat Kaur. I'm part of the NIHR as well, another involvement lead, and my work is about coordinating public involvement across the organisation.
And then finally, I'll pass you on to Mal.
Hi everybody, yes, I'm Mal Perlin. I'm a Senior Programme Manager at the NIHR and I specifically manage personal awards.
Thank you all for introducing yourself. And later on in the webinar, we'll also have a public contributor and a fellow researcher, a fellowship awardee who will also be giving their feedback on PPI. Next slide, please. So I'll just go briefly on what we're going to cover today. An overview of NIHR Academy Awards, the UK Standards for Public Involvement in Research, guidance on co-producing a research project, and what NIHR is looking for in the public involvement section of the researcher's application. And also we will be having advice and guidance from the RDS service, and there will be also a section on payments and recognition for public involvement. Next slide, please. I'll now pass you on to Mal, who will briefly discuss the different awards at the NIHR Academy.
Thanks, Linda. Yes, hi everyone. So I'm going to be really brief here because Linda's invited me specifically to simply provide some context representing the streams of fellowships that the NIHR we'll be talking about and discussing today. To do this, I think it helps to understand that we offer three fundamentally different streams of fellowships. If we can move on to the next slide, please. So those three streams of fellowships are managed by three teams. At the NIHR that manage our personal awards, we've got a personal awards team that manages strictly academic fellowships, an integrated pathways team which manages fellowships and awards that are enable an individual awardee to pursue a practitioner academic career, one that enables them to develop professionally and academically in parallel, and also infrastructure and capacity building structures team, which supports fellowships that are based within and around the NIHR infrastructure, which is a very broad spectrum of supporting organisations and bodies, as you can see there. So next slide, please. So looking at those streams and schemes in a little bit more detail, we've got them here on this slide. This is everything that constitutes an Academy Award at present, and you can see those three distinctions are here again, but horizontally this time. We've got our specifically academically focused schemes on the top row there, pre-doctoral fellowships, doctoral fellowships, and the advanced development and skills enhancement awards, and onwards to the research professorships. And then below that, we've got the practitioner academic awards, and there's three separate streams of those. One for statutory registered healthcare professionals who aren't doctors or dentists, which is the ICA scheme on the top there. The middle row is for individuals based within local authorities and local authority supporting services. And then beneath that, in the slightly oranger row, we have a stream for doctors and dentists as well. But all of those three sets of fellowships, or those three programmes, support and enable the individual undertaking them to work as a practitioner and as an academic and develop academically at the same time. And going back to those three streams and the importance of the distinctions between them, when you as a prospective applicant or somebody supporting an applicant or working with an applicant chooses a stream or a scheme to go for, you should really be thinking about the career aspirations of the awardee or the prospective awardee, and those career aspirations should match the objectives of the programme to make sure that you get a scheme that suits you. I think that pretty much covers it from me. I'm going to be around obviously until the end of the Q&A in case there are any questions that relate specifically to the schemes that we manage. Oh, one more thing I should say actually while I'm here, while I've got this slide up. The column on the far left there, the pre-doctoral level, I don't know if you can, yeah, you can see it, okay. So the pre-doctoral level, the pre-doctoral fellowship, and the ones below that, those schemes don't have PPI committee members on them, assessing them, but they will be assessed by the academic committee. Everything to the right of that, so the doctoral fellowship and post-doctoral fellowships, have lay members, PPI members on the interviewing committees. So those schemes interview shortlisted candidates, and at that point, your PPI members will be interviewing the applicant with regards to PPI that they're proposing. But the pre-doctoral level, there are no interviews, so therefore there are no PPI members on those committees. I think that's it from me. Thank you.
Thank you, Mal. Next slide, please. Okay, thank you, James. So in this slide, we're going to discuss NIHR's definition of public involvement. And when we mean by public involvement, that includes patient, carers, and service users. So NIHR defines public involvement in research as research carried out with or by members of the public rather than to, about, or them. So you can see it's very much a partnership. And NIHR goes on to define the difference between involvement, participation, and engagement. Involvement are where members of the public are actively involved in research projects. So for instance, members of the public are co-producing a research with the researcher, perhaps helping design the research, also sort of contribute to different aspects of the research. So they're very much partners. Participation is where members take part in research. For example, members of the public may be asked to complete a survey to gather more feedback about the subject area relating to the research. Engagement is when members of the public are given information and knowledge about the research. So this is whereby perhaps the research has finished and the researcher is disseminating his findings to members of the public. But really, patient and public involvement really focuses on involvement. That's quite important. So just knowing the difference between the three. Next slide, please. So why involve members of public in research? It's very important. NIHR's briefing notes for researchers guidance. So just to say, they will be, if you want to receive the slides afterwards, there's a hyperlink in all the slides, which will direct you to the documents that we mentioned. So in this briefing note for researchers, NIHR discusses why it's important to involve members of the public in research. So first of all, democratic principles. People who have been affected by research should have a say in it. Again, it provides like an empowerment, people feel empowered when they get involved in research that, especially when it affects them. The second is providing a different perspective. Very often, I'll give my example of type 2 diabetes. A researcher could be doing a research on type 2 diabetes, but may not have the lived experience of having type 2 diabetes. So it'd be useful to have members of the public get involved in research who have that lived experience. So that's providing a different perspective. Then we also have improving the quality of research. So research participants from a community involving members of DACO. So basically, again, using my my example of type 2 diabetes, it would improve people who are affected by that long-term condition. And again, another aspect why it's important to involve members in the public in research. It makes the research more relevant, to make sure you are including a diverse amount of people from the public. The other aspect why it's important to involve members of the public in research is that it's very much so, at NIHR, it's very much an expectation of funding in terms of PPI, especially with the awards that Mal mentioned earlier. So it's very, that require PPI. So it's very much an expectation of funding. And if you have not put a PPI section in your application, you do need to explain why. And then the last is ethics. So the Research Ethics Services ask for PPI to be included in research if you apply for ethical approval. So these are all the important reasons why it's important to involve members of the public in research. Next slide, please. So as discussed, PPI is really at the core what we do. NIHR is very, values PPI very highly and expects it in the research that it funds. And as I mentioned, if you haven't included that, you need to specifically explain why you've not included PPI in your research application. Next slide, please. Okay, so in this slide, I'm going to discuss what specifically are we looking for. So what NIHR is looking for in the public involvement section of the researcher's application for fellowship awards. So NIHR is expecting you to describe how patients, service users, carers, and members of the public have been involved in developing the research proposal. So even from the designing stage, how they've been actively involved in that. We also expect you to describe the ways in which patients, service users, and carers, and members of the public were involved in the proposed research, including training and support. This should also include your PPI approach, management, and support used. And you should also include a summary of your PPI activities. And as I said earlier, for those who want it, this slide would also be disseminated, so you can always refer to this at a later point. Next slide, please. Okay, finding public contributors, very important. It's one thing to know how to apply PPI effectively. It's another to trying to find people to be involved in research. So there's a website called People in Research, whereby researchers can go and advertise that they're looking for public contributors, and members of the public also go to this website to say they want to be involved in research. And you can actually click on, there's going to be a link on additional resources, but if you just type people in research on the internet, search NIHR people in research, that should actually come up on the website. There's also social media as well. We have various social media platforms where you could advertise for public contributors. We have also NHS clinical commissioning groups and NHS trusts. NHS clinical commissioning groups, we have what they call patient participation groups. This is whereby patients in that CCG area will form and meet and discuss with the CCG leads about improving the services in that area. So there's normally like an engagement officer or engagement manager that you can contact in your local CCG and then ask them if they are willing to sort of send information to the patients about being involved, or just liaise with the engagement officer of that CCG. There's NHS Trust. A lot of NHS Foundation Trust have a membership, and you could contact the membership and engagement officer there and then inquire about, seeing if the members of that trust may be interested in getting involved in your research. There's universities as well. There's charities. A lot of charities have memberships, so you could contact various charities. From charities with concentrated on long-term conditions as well, but just be compliant with privacy laws and GDPR. But these are various forms of where you can seek out public contributors. Next slide, please. So in this slide, I will discuss how it's important in the various ways you can involve members of the public in research. So again, NIHR has a briefing note for researchers, which is called the involvement in the research cycle. And at various parts of the cycle, you can involve members of the public. So first of all, identifying and prioritizing. So this is a stage whereby the researcher can, focus on prioritizing research questions with people with lived experience. So this is again another stage where the researcher can involve members of the public. There's also commission as well. So for example, NIHR recruits and supports patients and carers and members of the public to give feedback on health and social care research regarding funding application. So you can actually involve them in that. We also have the designing and managing stage. Again, designing and managing the research, they can be involved in that. They can also be involved in undertakings. So for instance, I mentioned whereby participation is where members of the public may be asked to complete a survey regarding the research. So you could invite members of the public to be the ones who actually go out and ask people to complete, you know, this survey. So you could devise different roles which members of the public can take on in your research. We also have the implementing stage, and we also have the evaluating impact. So as the research is over and you want to sort of disseminate your research findings, you may also want to include members of the public to share how the research has impacted the public. Next slide, please. So I will now discuss the UK Ppi Standards for involvement. Next slide. So these are a set of 6 agreed values that they have come up with to say that these are the values that are very important in research. So it was designed by NIHR and also developed over 3 years by the 4-Nation Partnership. And it's just like almost like a guide and a reassurance for public contributors, for researchers, PPI managers and leads in terms of using this guide to using these 6 values as a guide in excellent standards in public involvement. Next slide, please. So what are the standards? First of all, we have inclusive of opportunities. So this is offer members of the public involvement opportunities that are accessible and reach different groups. So making sure that when you're involving members of the public, that you're making sure that you are adhering to equality, diversity and inclusion, that you are inclusive of your opportunities, if your budget perhaps allowed, or you are producing information perhaps in different languages, just making sure that you're catering so there isn't any barriers for different types of members of the public to get involved in research, so that you're removing those barriers and being as inclusive as possible. The second standard is working together. So work together in a way that values opportunities and that builds and sustains mutual respect, practice and relationships. Again, when you're working with members of the public, it's very much a partnership. So you are respectful of them, you respect their ideas and vice versa. The third is support and learning. So you offer any support and learning opportunities. So members of the public should come from the research being more enriched, having improved, maybe even gain more skills or networking. So you're supporting them and making sure that they're well equipped to be involved in research. Communication is another key aspect. So using plain language as much as possible, and making sure that your communication is relevant. So again, you're making sure that you're communicating quite clearly. And impact is about sharing your the research findings and the impact your research has made in terms of the community that you're involved in. And then lastly, we have governance. Involve people in research, management, regulation, leadership, and decision making. So these are the 6 standards, the 6 UK standards of patient and public involvement in research. Next slide, please. As I mentioned earlier, the standards are for everyone in health or social care research. It can be used for researchers, research organizations, public involvement manager. I know I use this standards as a guide as well, especially when we are looking to do our recruitment for public contributors. And I know that our public contributors, some of them use this as a guide when they're assessing the PPI section of a researcher's application. Next slide, please. Okay, I'll now pass you on to our public contributor. Thank you.
Hello, my name is Susan, and I this spring completed a term of office for NIHR as a patient and public involvement member. I sat on doctoral fellowship panels, selection panels, amongst others. So my guidance to you is based on all the applications that I have reviewed. Next slide, please. So first of all, who are PPI panel members? I should perhaps tell you. Well, they generally have a significant background in various forms of patient leadership. That might be with a condition-specific charity or an organisation like Healthwatch. It might be as the chair of a patient and participation group at their local GP practice. It might be sitting as a lay member on a trust board. It could, and very likely is, a combination of all those sorts of activities. And so I want to share my thoughts with you on what these applications look like from our perspective. So usually on a selection panel, there are 2 PPI members. And we have a particular responsibilities in 2 areas of the application. Firstly, the plain English statement, and the other is the patient and public involvement section of your application. And I should say that although our assessment contributes to the overall scoring of your application, the PPI members actually have different criteria and judgments to the academic clinicians on your panel. So like all the panel members, quite a lot happens before we ever get to meet you at the selection interview, and particularly in respect of the plain English statement, which we actually score and send in the scores before the selection panel meets. And the reason for this is so that NIHR has advance notice of anybody whose plain English statement doesn't meet the criteria, and therefore this might be a condition for actually receiving funding, depending upon the outcome of all the panel scores and the ranking in the selection round that you've applied for. So we'll talk first of all about plain English. The importance of the plain English statement is this is about access to your research, particularly for patients, members of the public, and researchers who are not specialists in your particular area. And the point is that the plain English statement is plain, i.e. lay English. Bear in mind that readers of tabloid newspapers have a reading age of about 10 or 11. And if you're an undergraduate, maybe a reading age of 17. So think where you pitch the language that you are using in your plain English statement, including, might I add, the title. The common error is to have a plain English statement where the statement is plain English, but you cut and pasted the research title from your research application and it appears to be in a completely different language. Please use metaphor and examples where this will help your reader. This is particularly useful if you're submitting a lab-based or maybe more theoretical research application. You don't have to go so far as the Professor Sir Jonathan Van Tam and his football analogies, but you can see he had a point in using them when trying to explain to the general public some of the technicalities of COVID and the pandemic situation. Also remember that effective formatting helps the accessibility and readability of your statement. Paragraphing, white spacing, section headings, bulleted lists, all these things make it much easier to digest what it is that you are trying to tell the audience. And remember too, your patients that you involve may well know the Latin medical name for their condition or disease, but probably not all the other specialist terminology around it. So you need to take that into consideration as well. So the other area we assess is the patient and public involvement, and we give feedback on that. And the importance of this is that it shouldn't just be a description of what patients or family and carers have told you, or the public involvement that you've written about in your application, but an account of how this has actually shaped the whole of your proposal and how it will influence the dissemination when it comes to that stage. It's very much a they said, I did model that you need to relate in your patient and public involvement sections. And your approach to PPI needs to be as diverse and inclusive as you can possibly make it. Ask yourself some of these questions. Whose voices need to be heard? How representative of the patient population for this treatment or procedure are those who are your contributors? Understanding, of course, that this varies depending upon whether you are dealing with a condition which is very common amongst the general public or is something that maybe only affects a minority of people. Are family and friends influential in deciding whether patients want to participate? Particularly if this is radically new treatments or approaches. The wider range of family and friends around a patient can be quite influential on whether they are willing to engage with these new ideas or new treatments or new approaches. Does your management or advisory panel include those who have lived experience of the condition you're working with? And as importantly, outsider voices who are completely new to your research and can sense checks those perhaps you've been involved with over a long period of time and may have become quite entrenched in their views about what should actually be tackled. It's also very important to remember that if you have patient and public involvement representatives, consider their training and development to support them in their role, but also consider what training and development you need, particularly if you've not worked with patient and public involvement representatives before. This can be very important to make this successful, and it's an area that shouldn't be ignored when you're drawing up your own training and development plan and budget. And budget leads me to a very important point. We look at your budget as part of reviewing the patient and public involvement activities and want to see that at the very least, it's adequate for what you've described in there. That also means meeting best practice, as Linda has said, regarding participation payments or reimbursing other expenses of your PPI representatives. And we would expect your PPI budget to be proportionate to the global sum you're asking for overall. It should be a reasonable percentage. And as has been previously mentioned, there are rare incidences when we discover that there's a zero PPI budget or allocation in your budget. And believe you me, we always spot those. Usually when it's followed up, it's because you as a researcher have found organisations other than NIHR who've been willing to sponsor your patient and public involvement activity. Well, that's brilliant and well done, but it would be really helpful if you accounted for that in your narrative about your patient and public involvement activities. So here are some observations based on the research applications I've looked at, how you can shape your patient and public involvement to make these sections most effective in your application.
Thank you, Susan. Thanks for that. Next slide, please. So in this section, I will discuss guidance on co-producing a research project. As it's co-production week, it's quite important to discuss this aspect. So what is NIHR defines co-producing a research project as an approach which researchers, practitioners and the public work together, sharing power and responsibility from the start to the end of the project. Again, it's very much a partnership. Next slide, please. I will now discuss the key principles for co-production. NIHR has a guidance on co-producing a research project, and they suggest that these are the key principles in regards to co-production. So first of all, sharing of power. Research is jointly owned and people work together to achieve a joint understanding. So the researcher shares power with the members of the public that are involved in the research, and they very much decide and make decisions about the research together. The second aspect, including all perspective and skills, this is very important. So making sure the research team includes all those who can make a contribution and embraces diversity, definitely. Again, adhering to equality, diversity, and inclusion, you embrace different perspective, and you make sure that they all feel very much empowered and heard when they're involved in co-producing research. The other principle is respecting and valuing the knowledge of all those working together on the research. So everyone is of equal importance, from the researcher to the members of the public involved in the research, and making sure that the researcher adheres to that and listens to the different perspective and information coming from the public. And the other aspect is being reciprocal. So everybody benefits from working together. But also, it's very important that when members of the public are involved in research, that their contribution is recognized. It doesn't always have to be in payment, but in terms of they can get something back from being involved in research, whether it's new skills, confidence, a wider network, but they're getting something back from being involved in your research. And then the last is building and maintaining relationships. So this is an emphasis on relationship being the key to sharing power and then valuing the people involved. So make sure that you sort of maintain this ongoing relationship and share the impact of your project with the people involved. So these are the key principles for co-production. Next slide, please. I will now discuss the key features of co-production. Again, this can be also seen on the document, the NIHR's guidance on co-producing a research project. The first key features is establishing ground rules. I think that's very important. Create a space that's respectful and people can be treated with respect. So you establish your ground rules in the beginning. Maybe you may want to discuss things like confidentiality, not talking over people, respecting people's opinions, even though it may differ from, yours or the researchers. So making sure that you establish the ground rules from the beginning. The other aspect is continuing dialogue. So dialogue for all those working the project and effective communication. Make sure there's a way to always communicate effectively, and that you're keeping everybody involved, up to date in that project, who's involved in that project. There should also be a joint ownership of key decisions. It is the joint ownership of key decision, which really differentiates between co-producing and collaborating. So the group can work together to decide who makes the decision and when. So it's not necessarily saying that everybody in the group must make decisions, but it's not just the researcher making decisions. The researcher could work together and say, well, so-and-so public contribution make a decision on this, and another public contribution makes a decision on that. So this is very important in terms of joint ownership and decision. The other aspect is a commitment to relationship building. So addressing power differences requires to develop an open, honest, trusting relationship. Again, it's all about respect and making sure you're respecting everybody involved in that project. There should also be opportunities for development, as you mentioned earlier, provision of training and support. And then you should also be flexible in your project, and know that, even though you may have a project plan, but as the project goes along, things may change, so be aware of the people's needs involved in that project, and make sure that you are flexible going forward. There should also be a continuous reflection of how the project is going, and making sure that you review how well you work together, and if any adjustments should be made. And then lastly, it's about valuing and evaluating the impact of co-producing the research. But so these are the key features of co-production, and they are in the guidance document produced by NIHR. I will now pass you on to Steve.
Thank you, Linda. So I'm going to give you a quick overview of the support that you can receive from the NIHR Research Design Service, particularly relating to support around public involvement. If anything that I say in the next 10 minutes or so, there's sort of three things to remember about the Research Design Service, or the RDS for short. Firstly, that it's free. It's you don't have to pay for anything. You can come to us and ask us questions. Secondly, it is a service to help you as researchers develop high quality funding applications. And we have a lot of expertise in different methodological areas. And three, that there is a research design service probably near you. So go and seek out where your local RDS or regional RDS office is, and there are contacts within the later links that Linda will show. The next slide, please. So we are a national service, split up into 10 regional services throughout England. We're part of the NIHR, and the whole aim of what we try to do is to help you as researchers turn a good idea into a competitive research funding application. And so we're there to help you develop those funding applications, taking it right through from those ideas to helping you to review applications, give you ideas and suggestions how to improve your methods. We won't write it for you, that's your job, but what we do is help you produce as high quality application as possible. And I've already said it's free. Next slide, please. So this is to just give you an illustration of the different areas that we can help you develop your funding application, and through looking at all aspects of what makes a good high quality funding application. So helping you to look at what the evidence is in order to demonstrate and justify the purpose of your search and why is it important, and use evidence to base that up. We look at your makeup of your team and ensure that you've got the right expertise from both from a clinical perspective and also from your wider support team in terms of people that can help you deliver your research study. We can look at how you may think about what the impact of your study may be in the future. You know, what is the potential benefits to the NHS and to patients, and how will that be realised? How can you actually start making an impact of your research through your research study as well as at the end? Importantly, we can help you with ensuring that you have meaningful public involvement in all stages of the research, including developing the application itself. We can give you advice about the right type of funder to go for. Obviously, you are going for the fellowships, but we can advise you as on what type of fellowship, which one's right for you. Are there other opportunities that you may be want to consider as well? And also, importantly, given the name of our service, we can help you on the design of studies, you know, and looking at the methods that are used, how you recruit people, how the different types of mixed methods you might take approach, statistics, sample sizes, all of that shebang, we can help you with. Okay, next slide, please. So in particular around public involvement, the research design service is quite well renowned for having some nice specialist advisors in public involvement across the country. So we have someone like me, I'm based in the West Midlands, but we have a public involvement leader, each of our 10 regional teams, and they are not just one person, they can also be several people that can advise you on your public involvement. And each one of those is also generally sort of a generalist methodologist as well, so they can really help you think about where best and where the most appropriate involvement activities are to help develop and design your research. We can give guidance on what activities you do and also how you do it, the quality of your approach of public involvement, which is really key, really trying to embed those UK standards that Linda talked about earlier. We can help you signpost you to public groups, patient groups, PBI groups, charities and communities through our networks. Some of our regions also have a panel for you to come and just to sort of give some ideas about your research. Now, those are generally generic panels, so they may not have the relevant lived experience for that you are needing input for your particular studies, but it's there just to help you think about the approach to public involvement, maybe get some initial feedback to help you then go on to engage and involve the relevant patient groups or people with lived experiences. We run learning and development workshops such as this, but also, specifically focus on the different approaches to public involvement, ways of doing community engagement, linking in with social care providers and social care groups as well. And also we offer a public involvement fund, which I'll go into a little bit more detail on the next slide, please. Okay, so that we are one of the very few funders that offer a pre-grant funding to support early public involvement, particularly to inform your research design. So this is to help you do all those public involvement activities that you want to ensure that your research is relevant, it's appropriate, it's going to be done in the most ethical way, to help you build up what that you include in the right outcomes and things like that. So all the areas that Linda had been talking about, that of how you may involve members of the public in your study, this can help you start those early conversations. Typically, the amount of the fund is about £350, but you can have a higher amount depending on the needs for your particular study. And it's there to pay, not for you, but actually for the time, the contribution, a thank you for public contributors, and any other expenses that they may incur as a result of being involved. Okay, more and more of this is done online, but it's still good to have those face-to-face interactions where it's safe and appropriate with members of the public and really work together. So there may be some travel expenses, parking expenses, things like that. And also there may be a need to pay for venues or catering as well, to offer a more neutral space for you to have those conversations, rather than maybe at an NHS trust or a university building, which can be quite imposing for some members of the public. And key to which underpins all of our public involvement fund in terms of the application and how we encourage you to include things, and also how we review it as well, is about promoting quality. And we use the UK standards as our framework to ensure that whereas people do high quality, and we fund high quality public involvement. Okay, next slide, please. So just a few hints and tips about developing up your fellowship application. Some of these have been mentioned slightly already, but not to reiterate that some of these points are really, really important when it comes to doing your funding application. You need to engage with the people and communities that the topic matters to. So it's ensuring that you are involving a broad range of voices, a diverse range of voices, and those that have relevant lived experiences. There's often a lot of anxiety from researchers to ensure that you have the most diverse group as possible. It's not necessarily being the perfect diverse group, it's doing what you can to ensure that your approaches are inclusive in order to attract and reach out to different groups who may be wanting and willing to be involved with you. So do the best that you can and work from that. Start small and then grow. In your application, it's really important to describe how the public has shaped your research design, and what difference have they made. It's not really good enough to say we met with a group of 4 patients, they had this experience of this disease, and we talked about our research, they liked it, they said our methods were okay. That's not good enough. We need to hear from you, and the reviewers need to hear from you about what difference that was made. It may be confirmatory. It may be saying that it was a well appropriate way of recruiting participants into a study, but that needs to be clearly described. And you do need to describe how public involvement will be embedded throughout the research. I wouldn't necessarily just leave it to all within the public involvement section. Use that as a summary of your activities and how that will be managed, but embed your public involvement throughout your main research plan at each area where it's appropriate, where you will be engaging with members of the public and where it will inform the delivery of the study. And ensure, Susan made brilliant for this, I don't need to repeat this, make sure your activities for public involvement are well costed and well supported. Go and speak to your finance departments. Next slide, please. I just press down. I'm not using slides. Okay, so we have within the IDS a number of resources to give you some extra guidance and support about your different approaches to public involvement. We have a general guidance about public involvement and funding applications and how we can help you through the RDS. We have a new resource out there which helps you think about the best ways to go and engage with different communities. Ensure that you take your time and you take the time to build up relationships with this. And our community engagement toolkit identifies 10 principles of good practice. And one of them is made, do the groundwork and prepare. So it's not easy, take the time to do it, and you will find the rewards from that. The other one that we have, which has recently been published, is a guide on differentiating between public involvement and qualitative research. While some of the approaches may be similar, the purposes are different. And it's been really clear in what is both, because if you start talking about public involvement in terms of doing a qualitative study within your application, that will be picked up by reviewers, and it will be taken as a piece of research and not as public involvement. So all those resources are on that website, rdsresources.org.uk. Next slide, please. And just to sum up, I've borrowed these sort of take-home messages from my friend and colleague, Jim Elliott at the Health Research Authority, and it just really highlights some really good principles and some simple messages around public involvement. So the first one is about involve the right people. So it's about involving the people with the relevant lived experiences that reflect your study population. Involve enough people. 1 is not enough, 2 is probably not enough, 3 is probably not enough either. It's about involving a wide range of voices, wide range of perspectives that have different characteristics that reflect your study population. And that includes both their ethnicity, and any other impairments and disabilities, social characteristics as well. Involve people enough. So, really think about where best, and talk to your public contributors, where best can they add value to the research, and involve them in that. And that could be either throughout the research study, or there could be particular elements where their input would really contribute well. And importantly, describe how it helps, both in terms of your application, stating what difference, how it shaped your application, and how it influenced it. But then also, as you develop your research and you start doing your research, really start describing and recording well about the contribution that public involvement used, and use tools such as there's a GRIP2 reporting checklist that can help you, enable you to report your public involvement in research activities. Okay, so that's it from me, Linda.
Thank you, Steve. I'll now pass you on to Joe. Next slide, please.
Hi, thanks for having me. Can you hear me okay? Great. So just to introduce myself, I'm Jo. I'm a physio by background, and I worked in the NHS for a long time with people experiencing homelessness in Glasgow. So I'm going to just take you through my experience of being completely novice in PPI through to a successful NIHR Doctoral Fellowship application. So first of all, when I started looking into my application process, I found out I had to do PPI. I didn't really know much about it. And I kind of thought, well, I probably was one of those people who thought it was a bit of a tick box exercise, insofar as I thought, I've worked with a clinical population a long time. I've done some small scale research. I think I know what I'm doing. And so I kind of contacted the RDS to find out what was involved, and applied for the Enabling Involvement Fund, which at the time was just £350. So I realised that my research was going to be about people experiencing homelessness. And while I was working at a university, I no longer really had the connection to that population as easily as I did when I worked clinically. So I needed to find an advocacy organisation who could help me find some people who are experiencing homelessness to meet up with and do my PPI activity workshops. So I contacted Pathway, which are a homeless healthcare charity, and met a guy called Stan, who was a leader of their Experts by Experience group, and we had a chat about what I was planning to do, and that he promised that he would find some people who were experiencing homelessness at the time, and that we would meet in a kind of central London location that was easy for these people to get to. So that was great. I had my plan. I had support from Stan to bring some participants in, and we carried out our PPI. I learned loads from them. I found out about how I could Recruit. They gave me advice on publication and dissemination. It was a really, really fruitful few hours with 6 experts by experience. So on I went and I wrote up my PPI for my application, submitted my application just before Christmas in 2017. And in the Easter holidays, I found out I had been unsuccessful in my grant application. However, when I kind of dusted myself off with the slightly harsh feedback, I had been highly commended for my PPI work, which felt like a nice thing in amongst some difficult to digest feedback. So one of my colleagues who I was working with at the time on the PPI kind of was very encouraging, saying, you should write this up. You know, you've done some PPI work with people who are really hard to get hold of. It's something that should be shared. We can learn from this. And I kind of was busy. I fobbed him off. I thought, I don't know if that's really got much I don't know how I would write that publication. So I kind of ignored him. Then fast forward to March 2020, I had started a pre-doc fellowship right at the start of the pandemic. So everybody's suddenly working from home. The supervisors I was under were very busy with COVID research. And I kind of needed to A, produce publications, and B, find things for myself to do in the early stages of this pre-doc. So I decided to take up the suggestion of my colleagues and get started writing a reflective piece about the PPI work I had done. So I went back to Stan, my colleague who was the expert by experience team leader who found the participants for me. We together thought about our experience of back then, what had gone well, what hadn't gone well, and what we had really learned from that. And so in the end, I did get that work published. And I feel that kind of reflecting on my experiences, it really did inform me as a researcher and inform my future work. So then come 2021, I was applying for a doctoral research fellowship again, but with a lot more experience behind me. And I was also working as a researcher on the COVID social study at UCL. And basically the work I had done back in 2017 that had gone well, the reflecting on my work and writing it up for publication really informed me as to how I could go about further PPI effectively. So again, I reached out to advocacy organizations. I was able to, reach hard to reach people whilst we were all working remotely and online. So these people had been facilitated to be supported with the tech that they needed to join a Zoom conversation. I found that the kind of diversity and representation was a really important part of the PPI. So by working with a colleague who could reach people who I couldn't, he was able to find people from different backgrounds, different levels of spoken English, men, women, lots of different age groups. So that was really positive. And I think what I learned from him was one thing he said to me when we were doing our reflective work. He said, you need to talk less and you'll need to listen more. So it's about shifting that power from the researcher constantly taking the information and actually letting people tell their stories. And when you listen to their stories, kind of digesting how that can inform your research. So again, thanks to that PPI and writing up into a new application, I was then successful in my doctoral research fellowship application, and I started actually doing that this month. So I'm at the start of yet another long research journey and will be carrying all the learning I've had from the PPI work I've done so far into my future as a researcher, which kind of brings me on to a phrase I found when I was thinking about this presentation, which is that our life experiences shape us into who we will become. So I suppose it's important to acknowledge that the life experiences of the people experiencing homelessness that I spoke to all those years ago in 2017 and then more recently last year, their experiences of their challenges of accessing healthcare and living on the street and looking for food, coping with a pandemic in those circumstances are so valuable and need to be really recognised, both with the financial compensation of the thank yous that we give people for taking part in PPI, but also need to be we need to respect that we are being given that information and people are willing to share what can be really difficult stories with us. But it's also important to recognise that having the opportunity to carry out PPI as a researcher has shaped me as a researcher. And for every piece of PPI I do, I have a better understanding of how that informs me as a researcher and also the projects that I will be doing now and in the future. So that in itself is a privilege and should be acknowledged. Thanks.
Thank you, Joanna. That was very comprehensive. that was very comprehensive in terms of feedback from researchers. So I will now pass you on to Merit.
Hi, so yeah, what I'm going to talk about has been covered by various people throughout, but these slides just kind of bring it all together because we've acknowledged this is a complex area for people, and sometimes people may need additional information. I will be very brief because all the information is in these slides, so you can take them away and look at them in your own time. Just to acknowledge the work of Sylvia Bertolli and the public contributors and everyone who've worked together to co-create this guidance. So payment, as you've heard before, it is important to acknowledge and value the skills, experiences and knowledge that public contributors bring to health and care research. There is enough evidence now that this all adds value, and therefore it is really important to value that through payment and through reward. But it also ensures that we have inclusive health and care research, and that people can be involved and shape health and care research and are prevented to do in doing so because they can't afford to be involved and they can't afford to work for free. Next slide, please. So we have, to help you, lots of guidance out there, and this guidance is shaped for different audiences. So the payment guidance for researchers and professionals really goes through things such as how to set up a payment policy, issues around welfare that you need to be that you need to be aware of, and how to, for example, reward and recognise children and young people. This is a new addition to this guidance, and that was because we realised that a lot of people weren't recognising and rewarding children and young people because they weren't sure of how to do so. So this is an additional aspect. Have a look at that guidance in your own time. Next slide, please. For members of the public considering being involved, this is also important for them to have guidance in terms of understanding whether payment, whether reward and recognition can work for them, how it can work for them, what are the factors that they need to consider. It has additional information on welfare benefits, because we know that some of our public contributors are in receipt of welfare benefits, and so that isn't a reason not to offer payment, but they may need to have additional factors that they need to consider. Next slide, please. So how you figure out how to pay and recognise people's involvement. Often this should really be a conversation with the people that you want to involve and the people who are leading the research. It shouldn't be something that's just determined by one party. Those conversations can really help understand whether reward and recognition needs to be, for example, monetary in terms of payment, but also whether non-monetary options are better for the people involved. We really need to take a very personalised approach. So by non-monetary reward in this sense, we mean things such as equipment and materials. Equipment was a huge thing that came out of the last few years of virtual working. The need for equipment was a factor. So it could include things like that, or training or learning options, access to venues, all sorts of things like that. So there are a whole breadth of options available for people. So in an ideal situation, yes, it's about having the conversation with people and really having very personalised approaches to how people are going to be rewarded and recognised, not having a blanket standard approach for every single person. What is crucial is having very clear information from the get-go of what public contributors can expect from the process, what they will need to contribute, and also how they will be paid. This is really important just to maintain relationships and also provide clarity very early on, and it helps people consider how they are involved and what they can and can't do. I will go on to the next slide, please. So how to start. Figure out why you're involving people, clarify the purpose, and therefore then figure out what activities are likely to be part of the involvement. You're not going to have an extensive list, but just starting to shape the activities that people are going to be involved in can really help you cost up things. It can help you understand how many hours people will need to be involved, and therefore what the costs relating to that are. In the guidance, there are example costs. These are not maximum costs. These are a guidance of what costs could look like. It is about valuing people. So if you feel people need to be paid more, that's obviously perfectly fine and acceptable within the guidance. So next slide, please. There are various things you need to consider in terms of how to budget for involvement. I am conscious of time and therefore I'm not going to go through everything, but the headings may be useful for you to reflect on in terms of when you're putting your application together. Next slide, please. Actually, just on that previous one, I just remembered that there was something in terms of, we often have carers costs or personal assistant costs. These are really good examples, or even childcare. These are really good examples of sometimes when costs need to be met in advance of an activity happening. People often need to be paid for those things ahead of time because they need to be able to then pay for the carer and PA costs. That is a really good example of why you need to talk to finance people, especially if you're in academic institutions or NHS trusts. They can really help us understand how people can be paid ahead of time and therefore cause less complications later on. Next slide, please. There are lots of different types of activities, but also specific staff that may need to be factored into your bid, and that is especially the case even if you're sat within a programme that's already been funded, because they may need additional funds for work that you need people to do. Next slide, please. So for organisations, one of the key concerns that we've heard and found is about employment status and tax. What are the regulations and rules around this in terms of public contributors who aren't essentially full-time employed staff in the same way that researchers or other staff members would be? So there is specific guidance around this. You can click on this. Again, really suggest you share this with finance colleagues or people who are going to be helping you with the process of payment in order to acknowledge what's in place and what needs to be considered beforehand, and what are the problems that you'll need to unpick. Next slide, please. So welfare benefits is of consideration to a number of public contributors that we work with. This is not an excuse to not offer reward and recognition, but it has added consequences for people. People will probably need to notify the job centre plus and all those type of situations beforehand so that they're aware of the implications of taking on any activity like this and being paid for it. It helps them understand what they may need to consider. We also have the benefits advice service, which provides more personalised advice for individual situations, and that's a really useful service that's offered for all public contributors who are part of the NIHR. Next slide, please. If you have any general questions around this, feel free to email us at the public recruitment email, and we'll be answering some questions now as well. Thank you.
Next slide, please. Thank you, Merit, for doing that. I'm really appreciating the interest of time. You did that quite quickly. But as Merit mentioned, the slides will be sent out when you complete the survey and leave your address. So I will just go quickly onto the additional resources. There's a link to the people in research. There's a link to the Learn for Involvement website, which is the NIHR's website, where we host a number of PPI resources and articles. We also have that's a dedicated website. We also have on our NIHR page PPI resources for applicants and research, and we also have a YouTube channel. So there's a number of PPI webinars on there as well following this link. So I will now go to the Q&A section. So slides can stop being shared, and you can direct questions to any member of our panel, and I will excuse me, I will read out the questions with the most votes. Any question that's not answered in here, if you can email it to the public recruitment at nihr.ac.uk, and we will get back to you with an answer. So first question, how can PPI contributors and researchers make sure that involving PPI is not just a tick box exercise with no real influence? My advice would be obviously all the things that we outlined here, from using the UK PPI standards as a guide, from even the guide on co-production. I think when you adhere to all that we've mentioned, that it wouldn't really be a tick box exercise, because you'll be following the guide that has been prescribed by NIHR and the UK PPI standard, like making sure you're inclusive of opportunities, and making sure that you are, literally following, adhering to equality, diversity, and inclusion. I just want to see if there's any member of the panel who wants to add to that.
Linda, I just wanted to say that the point is, if you describe impact, it can't be a tick box. It will be descriptive if it's just a description, but if you describe the impact of what the public and patient involvement has been, then it can't be just token.
So I think put that as answered, James. So the next, how can people be certain there was involvement as was outlined in the application? Okay, so is this a question about making sure, there's one thing to sort of state it in the application, there's another thing to make sure that you've adhered to it? Is that I'm not quite sure if I understand the question clearly, but I'll open up this to the panel if anybody has any answers for that.
I took the question as, ensuring that there is sort of honesty in the approach that you've done what you said you had done. And I think, as with all application, there is a level of honesty that is required within making applications. I think that the reviewers expect that people are honest within that. And I also think in terms of public involvement, it would be really easy to see where things may not have happened, because if you just, like Susan says, if you describe how people suggested things and it made a difference to that, that's going to take some rather creative writing, I think, to actually talk about that if it didn't really happen. So I would suggest do it. If you're going to do it, or you said you're going to do it, make sure that you have, because otherwise it will be clear that that's not necessarily been the case.
Thank you, Stephen. So that can be a particular answer. Next question is involving patients and service users particularly useful at the recruitment stage? I would say it is, especially when you even I mentioned earlier about involvement in the research cycle. So it details the different aspects where you could involve people. I would say that this is quite useful, and you might be able, by involving patients and service users, you could also actually attract a more diverse public contributions to your research. So you may know a community leader in a particular community that may be able to influence the people in the public in that community to get involved in research. Stephen, please.
Yeah, I would say the answer to the question is yes, both in terms of advising and suggesting the best approaches, the best ways of recruiting participants into a study, how you might, the different areas, the different routes that you might take to recruiting participants. Also, I think there's some value in working with members of the public to actually be actively part of the recruitment process, and encouraging other patients to take part, maybe asking. That particular aspect would need ethics on that, because they're actively involved in encouraging patients to consider taking part in the study. So that particular aspect would need sort of ethical approval, but the advice, as just giving advice about approaches, would not.
Thank you, Stephen. That's very comprehensive. So that's answered. Bear with me. Okay, so I'm not quite sure the answer to this question. I'll read it out. If you're doing research on serious crime and sexual reoffending, would you be expected to involve PPI in some way?
It's a really difficult question, if I may answer. I think that you should try and have public input into all research. This particular area would need some serious consideration. It may not be appropriate to involve people with direct lived experiences of this. It may be too raw, it may be too sensitive. But then there are advocates or groups that support people who may have experienced these conditions that may be able to give advice and be involved in your study, maybe people with indirect experience of it. So it's real careful consideration about how you do that. There have been a couple of questions in the questions about ethics. In general, no, people do not need ethics to involve members of the public as part of the research team. But this particular occasion, if you do suggest, it may be worth getting advice from an ethics committee about your approach to this, because you maybe that you're working with vulnerable people, or you're putting yourself in vulnerable positions to do that. So there may be an ethical element to that. Joe.
Thank you, Stephen. That was very comprehensive.
Joe put her hand up for it.
I was just going to add that having worked with people experiencing homelessness, many of whom have had particularly awful life experiences, all I would say is, regardless, even if you're working with people with extreme life experiences, you must try and find a way to include their voice in your research, or your research is as likely to be off target as anyone who's working with maybe an easier population to work with and hasn't included them. So I think it has to be a yes, but like Stephen said, that the ethical considerations maybe need more thought before you approach how you go about it.
Thank you. So in the interest of time, I do apologize. We'll just take one more question. As I said, if your questions have not been answered today, please send it to publicrecruitment@nihr.ac.uk, and we will definitely get back to you. So the next question will be the last, which is, what does public mean, and can it include healthcare professionals if your research will matter to them and are they key people to be engaged? I would say for my, public really includes carers, service users, and patients. In terms of healthcare professionals, that is an interesting aspect, because I haven't come across ones that where you've involved. Steve has his hand up, so I'll go to Steve.
If your research is on healthcare professionals, like studying the experiences of nurses or doctors providing a certain service, then yes, these are the people with the lived experiences. So in those circumstances, yes. For others where your focus study is on patients as the end user, then I would suggest that healthcare professionals are an important stakeholder to speak with. They may not be regarded as public, but not necessarily so. I think there's a movement towards being more broad in people's approach to that. What would be wrong is if you just spoke to healthcare professionals and no patients. That would be weird. So it's about ensuring you have a broad range of voices, which may include healthcare professionals. So I would say yes, in part.
Thanks, Steve. That was a very comprehensive answer. But like I said, just to remind you, when we say public in NIHR, we are referring to service users, carers, as well as patients. So we'll now come to the end of the webinar. I first want to thank Susan Edge, our public contributor. She's been very instrumental in terms of putting the webinar together, and I'm really grateful for her feedback. I also want to thank Marriott. Apologies that your section is a bit rushed, but thank you for coming in and discussing payment. And as Marriott said, if you have a question directly for payment, please email ced@nihr.ac.uk. I also want to thank Mal, the program manager, who came on here and gave up his time to discuss the different awards that we have. I also want to thank Joanne, our researcher, for also giving up her time to discuss the PPI application in her research. I want to thank James behind the scenes for the comms and making sure that the webinar runs smoothly. Last but not least, I want to thank Stephen for his great insight and input. It was really, really useful having the Research Design Service on here to said the Research Design Service offers free support in terms of people. So I'm really grateful for you, Steve, for taking part this webinar. So I just want to thank everyone for attending and have a great rest of the day. Bye.